Okay, we're going to start this all over. All right, because we've been out too long. So here you go. Consciousness is defined as a person's awareness of the world around him or her. Most waking hours are spent in waking consciousness, a state of awareness where thoughts and feelings are clear and organized. Altered states of consciousness are shifts in the quality or patterns of mental activity. The most common state of altered consciousness is sleep, but other examples include being under the influence of drugs or alcohol, daydreaming, or being hypnotized. The sleep-wake cycle is a circadian rhythm, meaning one cycle takes 24 hours to complete and is controlled by the hypothalamus. There are two theories about the functions of sleep. One, the adaptive theory, and two, the restorative theory. When people go through the sleep cycle, they typically go through these stages. Stage 1, light sleep. Stage 2, sleep spindles. Stage 3 and 4, deep sleep, and rapid eye movement, which is REM. As we sleep, we dream. Freud's method of dream analysis still plays a role in psychodynamic theory, but a more recent theory known as the activation information mode model has been developed to explain the function of dreams. Meditation affects consciousness by refocusing attention to achieve a trance-like state to aid in relaxation. Hypnosis is a state of consciousness in which a person is susceptible to suggestion. Now let's go back, all right, to consciousness. All right, what are the different levels of consciousness? Well, I mentioned the definition for consciousness. I gave you the definition of waking consciousness, a state in which thoughts, feelings, and sensations are clear, organized, and the person feels alert. Altered state of consciousness occurs when there is a shift in the quality or pattern of your mental activity. When your mental activity drifts away from normal, waking consciousness in some way, your thoughts may become fuzzy and disorganized, and you may feel less alert, or your thoughts may take bizarre turns, as they so often do in dreams. You may also divide your consciousness awareness, as when you drive to work or school, and then wonder how you got there. One level of conscious awareness was driving, while the other was thinking about the day ahead. This altered state of divided consciousness can be a dangerous thing, as many people who try to drive and talk or text on a cell phone at the same time have discovered. Driving and carrying on a conversation on a phone are both processes that demand focused attention, and it is simply not possible to do both at once in a safe and efficient manner. Studies have shown that driving while talking on a cell phone, even a hands-free phone, puts a person at the same degree of risk as driving under the influence of alcohol. There are many other forms of altered states of consciousness, being under the influence of certain drugs, daydreaming, being hypnotized, or achieving a meditative state. But the most common altered state people experience is the one in which they spend about a third of their lives on a nightly basis, sleep. Here are your preview questions. First, we should talk about circadian rhythms. The sleep-wake cycle is a circadian rhythm. The term actually comes from two Latin words, circa, about, and diem, day. So a circadian rhythm is a cycle that takes about a day to complete. For most people, this means that they will experience several hours of sleep at least once during every 24-hour period. The sleep-wake cycle is ultimately controlled by the brain, specifically by an area within the hypothalamus, the tiny section of the brain that influences the glandular system. Although people can do without sleep sometimes, jet lag is a disruption of the sleep-wake cycle, okay, and it takes some time to get back into it. There are certain things called microsleeps, or brief sidesteps into sleep lasting only a few seconds. All right. For instance, in one experiment, rats were placed on moving treadmills over water. They couldn't sleep normally because they would then fall into the water and be awakened, but they did drift repeatedly into microsleeps, or brief sidesteps into sleep lasting only seconds. People can have microsleeps too, and if this happens while they are driving a car or a truck, it's obviously bad news. Microsleep periods are no doubt responsible for a lot of car accidents that occur when drivers have had very little sleep. So what happens? How does the sleep cycle work? There are different kinds of sleep, all right? And question, do you go from being awake to being asleep and dreaming? Is it instant? Well, there are actually two kinds of sleep. One is REM, and the other is non-REM. REM, or rapid eye movement sleep, is a relatively active type of sleep when most of a person's dreaming takes place, whereas non-REM sleep is a much deeper, more restful kind of sleep. In REM sleep, the voluntary muscles are inhibited, meaning that the person in REM sleep moves very little, whereas in non-REM sleep, the person's body is free to move around. There are also several different stages of sleep that people go through each night in which REM sleep and non-REM sleep occur. A machine called an electroencephalograph, an EEG, allows scientists to record brain wave activity as a person passes through the various stages of sleep, and to determine what type of sleep the person has entered. This figure illustrates brain waves of different stages of consciousness. A person who is wide awake and mentally active will show a brain wave pattern on the EEG called beta waves. Beta waves are very small and very fast. As the person relaxes and gets drowsy, slightly larger and slower alpha waves appear. The alpha waves are eventually replaced by even slower and larger theta waves, which indicates stage 1 sleep. Delta waves, the slowest and largest waves, replace theta waves during the deepest cycle of sleep. Non-REM stage 1 sleep. As theta wave activity increases and alpha wave activity fades away, people are said to be entering stage 1 sleep, or light sleep. If people are awakened at this point, they will probably not believe that they were actually asleep. In this state, between sleep and wakefulness, they may also experience vivid events called hypnagogic images. These images are bits and pieces of what may eventually become dreams, but are most often seen as flashes of light. Some people have very vivid images that seem realistic. Many researchers now believe that people's visions of ghostly visits, alien abductions, and near-death experiences may be most easily explained by these images. The term is hypnagogic, Hypnagogic images. Non-REM stage 2, sleep spindles. As people drift further into sleep, their body temperature continues to drop. Heart rate slows, breathing becomes more shallow and irregular, and the EEG will show the first signs of sleep spindles, brief bursts of activity lasting only a second or two. Theta waves will still predominate in this stage, but if people are awakened during this stage, they will be aware of having been asleep. Non-REM stage 3 and stage 4, delta waves roll in. In the third stage of sleep, the delta waves, the slowest and largest waves, make their appearance. In stage 3, delta waves make up only about 20 to 50% of the brainwave pattern. Once delta waves account for more than 50% of total brain activity, the person is said to have entered stage 4 sleep, the deepest stage of sleep. It is during this stage that the body is at its lowest level of functioning. Eventually, the delta waves become the dominant brain activity for this stage of sleep. People in deep sleep are very hard to awaken. If something does wake them, they may be very confused and disoriented at first. It is not unusual for people to wake up in this kind of disoriented state, only to hear the crack of thunder and realize that a storm has come up. Children who need deep sleep so that their bodies will grow are even harder to wake up when in this state than are adults. What happens in REM sleep? After spending some time in stage 4, the sleeping person will go back up through stage 3, stage 2, and then into a stage in which body temperature increases to near waking levels. The eyes move rapidly under the eyelids, the heart beats much faster, and the brain waves resemble beta waves, the kind of brain activity that usually signals wakefulness. The person is still asleep, but in the stage known as REM sleep. When a person in REM sleep is awakened, he or she almost always reports being in a dream state. REM sleep is therefore associated with dreaming, and 90% of dreams actually take place in REM sleep. People do have dreams in the other non-REM stages, but REM dreams tend to be more vivid, more detailed, longer, and more bizarre than the dreams of non-REM sleep. Non-REM dreams tend to be more like thoughts about daily occurrences and far shorter than REM dreams. Fortunately, the body is unable to act upon these dreams under normal conditions because the voluntary muscles are paralyzed during REM sleep, a condition known as REM paralysis. Here's the chart that shows you how many times you go into REM as you go from sleep to waking. Why do we sleep? Well, there are certain theories that exist about the functions of sleep. According to the adaptive theory of why organisms sleep, sleep is a product of evolution. Animals and humans evolved different sleep patterns to avoid predators during the predator's normal hunting times, which are generally at night. If a prey animal is out and about at night, it is likely to be eaten. If instead it is in a safe place sleeping and conserving energy, it remains safe. The other major theory of why organisms sleep is called restorative theory, which states that sleep is necessary to the physical health of the body. During sleep, chemicals that were used up during the day's activities are replenished, and cellular damage is repaired. There is evidence that most bodily growth and repair occur during the deepest stages of sleep. Which of these theories is correct? The answer is that both are probably needed to understand why sleep occurs the way it does. Adaptive theory explains why people sleep when they do, and restorative theory explains why people need to sleep. How much sleep is enough? The answer varies from person to person because of each person's age and possibly inherited sleep needs. But most adults need about 7 to 9 hours of sleep each 24-hour period in order to function well. Some people are short sleepers, needing only 4 or 5 hours, whereas others are long sleepers and need more than 9. The other question that's commonly asked is, why do we need a REM sleep? Why two kinds of sleep? And why would REM sleep ever be considered restful when the body is almost awake and the brain is so active? REM sleep seems to serve a different purpose than does non-REM or deep sleep. After a very physically demanding day, people need to spend more time in non-REM deep sleep than is usual. But an emotionally stressful day leads to increased time in REM sleep. Perhaps the dreams people have in REM sleep are a way of dealing with the stresses and tensions of the day, whereas physical activity would demand more time for recovery of the body in non-REM sleep. Also, if deprived of REM sleep, as would occur with the use of sleeping pills or other depressant drugs, a person will experience greatly increased amounts of REM sleep the next night, a phenomenon called REM rebound. Why do we dream? Well, the question really is, do dreams serve a function? Because we spend a large part of our lives asleep, most of us are very familiar with one of sleep's most notable features, dreaming. Dreams have long been a source of curiosity. People of ancient times tried to find meaning in dreams. Some saw dreams as prophecy, some as messages from the spirits. But the real inquiry into the process of dreaming began with the publication of Freud's The Interpretation of Dream. Sigmund Freud believed that the problems of his patients stemmed from conflicts and events that had been buried in their unconscious mind since childhood. One of the methods Freud devised to get at these early memories was to examine the dreams of his patients, believing that conflicts, events, and desires of the past would be represented in the dreams. The manifest content of a dream is the actual dream itself, as we remember it when we wake up. For example, if Chad has a dream in which he is trying to climb out of a bathtub, the manifest content of the dream is actually that he's trying to climb out of the bathtub. But of course, Freud would no doubt find most meaning in Chad's dream than is at first evident. He believed dreams contained hidden truths or latent content expressed through symbols. In the dream, the water in the tub might symbolize the waters of birth, and the tub itself might be Chad's mother's womb. Chad may have been dreaming about being born in Freudian terms. Today, many professionals are no longer as fond of Freud's dream analysis as they once were, although dream analysis still plays a part in psychodynamic therapy. Then we have the activation synthesis hypothesis. In a theory called the activation synthesis hypothesis, a dream is merely another kind of thinking that occurs when people sleep. It is less realistic because it comes not from the outside world of reality, but from within the brain due to random neural firing that triggers people's memories and experiences of the past. The frontal lobes, which people normally use in daytime thinking, are more or less shut down during dreaming, which may also account for the unrealistic and often bizarre nature of dreams. Okay. Sometimes dreams can be really weird, but sometimes they're pretty normal. All right, are they meaningful? Well, Hobson and colleagues have reworked the activation synthesis hypothesis to reflect concerns about dream meaning, calling it the Activation Information Mode Model, or AIM. In this newer version, information that is accessed during waking hours can have an influence on dreams. In other words, when the brain is making up a dream, it uses meaningful bits and pieces of the person's experiences from the previous day or the last few days, rather than just random items from memory. We've already talked about sleep deprivation. So this is the slide that you have for sleep deprivation. I'm going to stick in here, what do people dream about? Calvin Hall collected over 10,000 dreams and concluded that most dreams reflect the events that occur in everyday life. Although most people dream in color, people who grew up in the era of black and white television sometimes have dreams in black and white. There are gender differences, although whether those differences are caused by hormonal or genetic influences, sociocultural influences, or a combination of influences remains to be seen. In his book, Finding Meaning in Dreams, Dr. William Domhoff concluded that across many cultures, men more often dream of other males, whereas women tend to dream about males and females equally. Men across various cultures also tend to have more physical aggression in their dreams than do women, with women more often being the victims of such aggression in their dreams. Girls and women tend to dream about people they know, personal appearance concerns, and family and home. Boys and men tend to have more male characters in their dreams, which are also typically in outdoor or unfamiliar settings and may involve weapons, tools, cars, and roads. In some dreams, people run, jump, talk, and do all of the actions that they do in normal life. Then there are dreams of flying, falling, and trying to do something and failing, all of which are very common dream themes across the cultures. Let's apply the concept of sleep deprivation to everyday life. Sleep deprivation has long been considered a fact of life for many people. Sleep deprivation was one of the factors indicated in such disasters as the explosion of the Challenger, the Exxon Valdez oil spill, and the Chernobyl disaster. Here are some other sleep deprivation facts. 30 to 40% of all heavy truck accidents can be attributed to driver fatigue. Drivers who have been awake for 17 to 19 hours are more dangerous than drivers with a blood alcohol level of 0.05. Sleep deprivation is linked to higher levels of stress, anxiety, depression, and unnecessary risk-taking. Clearly, sleep deprivation is a serious and all too common problem. Many of the sleep disorders that are discussed and that will be discussed are themselves causes of sleep deprivation. Sleep apnea, narcolepsy, sleepwalking, night terrors, and a condition called restless leg syndrome, in which a person constantly moves his or her legs because they feel tingly, are all causes. Yet these problems are not the sole or most common cause of sleep deprivation. The most obvious cause is the refusal of many people to go to sleep at a reasonable time, so that they can get the required hours of sleep that most adults need in order to function well. People want to watch that last bit of news, spend time on social networking websites, or get a little more homework done. Another reason for sleep loss is stress and worry. Finally, some medications that people take, both prescription and over-the-counter, interfere with the sleep-wake cycle. For example, decongestants that some people take to relieve sinus congestion may cause a racing heartbeat, preventing them from relaxing enough to sleep. According to psychologist Fahey, you may be sleep deprived if you actually need your alarm clock to wake up, find getting out of bed in the morning is a struggle, feel tired, irritable, or stressed out for much of the day, have trouble concentrating or remembering, fall asleep watching TV in lectures or warm rooms, fall asleep after heavy meals, fall asleep within 5 minutes of getting into bed. A well-rested person actually takes 15 to 20 minutes to fall asleep. Sleep disorders. What are the different types of sleep disorders? Real sleepwalking, or somnambulism, typically occurs during stages 3 and 4. It occurs in about 20% of the population and is at least partially due to heredity. It is much more common in childhood and also occurs more frequently in boys than in girls. Although the old movies portray sleepwalkers as zombie-like with arms outstretched, In reality, a sleepwalker may do nothing more than sit up in bed. But other sleepwalking episodes may involve walking around the house, looking in the refrigerator, or even eating or getting into the car. Sleepwalking actions are usually routine, but some sleepwalkers do things like rearranging furniture that they wouldn't normally do if they were awake. Alex, the child who suffers night terrors, is a child who suffered night terrors. He also suffers from sleepwalking. His parents also found that preventing sleep loss made sleepwalking a rare occurrence. When Alex did have an episode, he never recalled it the next day. This lack of memory is typical of most sleepwalking episodes. The only real precaution that the families of people who sleepwalk should take is to clear their floors of obstacles and put hard-to-reach locks on the doors. Being able to act out one's dreams, especially nightmares, is a far more dangerous proposition than sleepwalking. Nightmares are bad dreams, and some nightmares can be utterly terrifying. Children tend to have more nightmares than adults do because they spend more of their sleep in the REM state, as discussed earlier. As they age, they have fewer nightmares because they have less opportunity to have them. But some people still suffer from nightmares as adults. Some people have a rare disorder in which they are able to thrash around and even get up and act out nightmares. This disorder is called REM behavior disorder, and it is a fairly serious condition. Usually seen in men over age 60, it can also happen in younger men and in women. Night terrors are a rare disorder, although one that is more likely in children and also likely to disappear as the child grows older. A night terror is essentially a state of panic, experienced while sound asleep, usually during stage 4. People may sit up, scream, run around the room, or flail at some unseen attacker. It is not uncommon for people experiencing night terrors to sweat profusely and feel unable to breathe. Considering that people suffering a night terror episode are in a deep stage of sleep and breathing shallowly, one can understand why breathing would seem difficult when they are suddenly active. Most people do not remember what happened during a night terror episode, although a few people can remember vividly the images and terror that they experienced. There are some real differences between night terrors and nightmares. Nightmares are usually vividly remembered immediately upon waking. A person who has had a nightmare, unlike a person experiencing a night terror, will actually be able to come awake and immediately talk about the bad dream. Perhaps the most telling difference is that nightmares occur during REM sleep rather than deep non-REM sleep, which means that people don't move around in a nightmare as they do in a night terror experience. Insomnia. Most people think that insomnia is the inability to sleep. Although that is the literal meaning of the term, in reality, insomnia is defined as the inability to get to sleep, stay asleep, or get a good quality of sleep. There are many causes of insomnia, both psychological and physiological. Some of the psychological causes are worrying, trying too hard to sleep, or having anxiety. Some of the physiological causes are too much caffeine, indigestion, or aches and pains. There are several steps people can take to help with sleep. Obvious ones are taking no caffeinated drinks or foods that cause indigestion before bedtime, taking medication for pain, and dealing with anxieties in the daytime rather than facing them at night. That last bit of advice is easy to say, but not always easy to do. Snoring is fairly common, occurring when the breathing passages get blocked. Most people snore only when they have a cold or some other occasional problem. But some people snore every night, sometimes quite loudly. It is this type of snoring that is often associated with a condition called sleep apnea, in which the person stops breathing for nearly half a minute or more. When breathing stops, there will be a sudden silence, followed shortly by a gasping sound as the person struggles to get air into the lungs. Many people do not wake up while this is happening, but they do not get a good, restful night's sleep because of the apnea. Apnea is a serious problem. Not only does it disturb nightly sleep, making the person excessively sleepy in the daytime, but it also can cause heart problems. If a person suspects the presence of apnea, a visit to a physician is the first step in identifying the disorder and deciding on a treatment. With mild apnea, treatment may be a device worn on the nose at night to open the nostrils and prevent blockage. Other treatments include losing excess weight and using sprays designed to shrink the tissues lining the throat. Some very young infants also experience a kind of apnea due to immaturity of the brainstem. These infants are typically placed on monitors that sound an alarm when the breathing stops, allowing caregivers to help the infant begin breathing again. A disorder affecting 1 in every 2,000 persons is narcolepsy. Narcolepsy is a kind of sleep seizure. In narcolepsy, the person may slip suddenly into REM sleep during the day. Another symptom is excessive daytime sleepiness that results in the person falling asleep throughout the day at inappropriate times and in inappropriate places. These sleep attacks may occur many times and without warning, making the operation of a car or other machinery very dangerous for the narcoleptic person. Treatments of narcolepsy include medications like stimulants, and behavioral changes like avoiding circumstances that interfere with sleep when it is needed.